Hi everyone, welcome to iMedics. I am Bindu, and today we will be discussing blurred vision. What are the common causes? What are the symptoms? And what are the treatments available to us? To talk to us about blurred vision today is Miss Shakti Thakur. She is the lead consultant and expert at iMedics. Welcome, Miss Thakur. It's lovely to have you with us today. I will let you introduce yourself to our audience.
Hello, Bindu. Thank you so much. As you know, I'm a medical retina specialist. I've been practicing in the capacity as a consultant for nearly 20 years. I've been working in medical retina for longer than that. Blurred vision is a vast topic. So it can cover problems from the front of the eye to the back of the eye. It can be a manifestation of problems within the brain, and it can also be a manifestation of problems that are affecting the body generally, or the effects of drugs. Thank you. Let's see what we would like to discuss within that area.
So, should we get started with our questions?
Of course.
To start with, like you said it yourself, what is blurred vision and what are the main causes?
So, blurring can be enormously variable. I think the most important thing to ascertain is we need to know from the patient the history. So is this a blurring that comes and goes? Is it momentary? Is it a particular patch that's affected? Is it central? Is it peripheral? And are there any accompanying symptoms? Is there any pain? When did it begin? As well as a general history. So is the patient diabetic? Have they had a stroke in the past? Are they on any particular medications? So all of those things are relevant.
Interesting. It's a very wide subject, blurred vision, as I can see from what you're just explaining to us. So when patients come to you with a concern that their vision is getting blurry or they've noticed that there's a change in the vision, where do you begin? Where do you start? What's the first step?
So after taking a detailed history, which is what we've just described, the first part of the examination would involve a refraction, so a vision with a corrected refraction, and that would determine whether or not there are refractive errors, so myopia or uncorrected astigmatism or presbyopia, those sorts of changes which are accounting for the problem. And then after that, it would be a detailed examination of the eye on the slit lamp. And then we would systematically examine the front of the eye, so the ocular surface, looking for dry eye problems, any problems with scarring of the cornea, any opacities within the lens, so cataract, looking at the intraocular pressure, whether there's a problem with that, has that gone too high, and then a detailed retinal examination. And the detailed retinal examination, these days we would normally require some additional investigations, such as an OCT scan and retinal photographs to look at the center and, where required, at the periphery.
Okay, that's good to know. There are some patients who complain about my blurred vision keeps coming and going. How do you distinguish between something that's harmless and something that's a more serious concern for a patient?
Okay, very relevant questions. Generally speaking, if there's inflammation in the eye or if it's a surface problem, dry eyes, something that's affecting the cornea, those conditions tend to be painful or at least uncomfortable. Those things tend not to be as sight-threatening necessarily as some of the problems that are occurring at the back of the eye. So painless loss of vision can sometimes be more serious. But then, of course, you have all the in-between. So whether, if you had a cataract or
right,
and so on, those things are not necessarily serious. So it all depends on context.
Got it.
Let me just give you a further example. So last week, I saw a 15-year-old who had intermittent jumping about and blurring of their vision, which they'd had for 4 weeks. Their retinal examination was unremarkable, except for possible swelling of the optic nerves. And I referred them on to a pediatrician because it could have been some systemic problem. It could have been a brain tumor causing high pressure within the brain, or it might even have been the effect of drugs that he was taking. A second patient that I saw had previously had a retinal vein occlusion and was concerned that the vision had become more blurred. The retinal examination, the OCT scan, showed absolutely no changes. And from the retinal point of view, the eye was completely stable. But I was concerned she might be having a stroke. And I referred her to the medical team, who in fact confirmed with imaging, CT scan, she was having a stroke that was affecting the back of the brain. And that was manifesting as blurred vision.
Oh, that's interesting to know. I'm sure our audience who's listening to us right now will find this very helpful. Since you're a medical retina expert, could you explain to our listeners how retinal diseases like dry AMD or diabetic retinopathy can cause blurred vision?
Of course, with diabetes, changes that affect the retina can be twofold. So first of all, there's a sort of gradual progression, normally takes a couple of decades or more, that affects the blood supply. And eventually the retinal blood vessels can become very porous and start to leak fluid in the center. And when that fluid starts to build up, that tends to affect the center of the vision, and the vision becomes blurred. It's important for that to be picked up. It is treatable. There are a lot of treatments that are available. The most commonly used treatment that we use these days is injections of anti-VEGF into the eye, and that's often very successful in stabilizing and improving that vision. So that's one manifestation. There are other problems with diabetic retinopathy. You can develop new blood vessels because the eye doesn't have a good blood supply. It's deprived of oxygen relatively. It grows new blood vessels. Those blood vessels are fragile. They can bleed into the eye and cause a sudden drop in vision, or can start showing the sight-threatening manifestations that require laser treatment before it's reached that critical bleed stage. So diabetic retinopathy is something that needs to be reviewed on a regular basis. Many places, patients are enrolled onto screening programs, so they go on a regular annual examination. And if any sight-threatening complications are detected, they're then referred to the retinal specialist. As far as dry macular degeneration is concerned, or macular degeneration in general, the macula is the sensitive central part of the retina, which is responsible for fine vision, color vision, detailed vision. And when that is affected, there are difficulties with daily tasks, such as recognizing faces, reading. The earliest manifestations may be difficulties in adapting from very bright conditions to more dim conditions. So very typically patients will say they've come in from the garden and they're finding it more difficult to adjust to the indoor environment. Those are the very earliest manifestations. And then later on, they may start to struggle with reading or particularly with fine print. And it's important that those patients see their optician to have a more detailed examination, because it can be difficult to tell at that stage whether it's just dry macular degeneration, whether it's wet macular degeneration, for which there are known treatments, or if it's dry macular degeneration that might benefit from some of the newer treatments that are available. They can be made available and make their choices.
It's good to know that that if they are suffering from any of these symptoms that we're talking about, there are treatments that they can choose today. My next question to you is, especially for our audience or our listeners who are here with us, if they've started to notice that their vision is changing a bit, but haven't actually made an appointment to go see their optician or their doctor, what would you suggest to them?
So, generally speaking, particularly patients over the age of 50, your risks of more serious conditions that affect the eye do start to go up. So particularly if it's a sudden onset change, then those patients really need to see their optician without delay. And when they're younger and it's just a bit of blurring that's coming and going, something like that, those symptoms are much more transient and they're much less likely to be something serious. But if it's something that persists, generally speaking, then patients should see their optician without delay.
I'm sure it's quite helpful. Ms. Thakur, thank you for explaining that so well to our audience. And to our audience, I'd like to say that if you have noticed that your vision is changing, it's time to go see your doctor or your optician to make sure that it isn't anything serious. If you have any questions, do write into us. For more details, you can log on to our website, imedics.co.uk. So till next time, take care of your eyes and remember that vision is worth protecting. Thank you.
Thank you.